Hello everyone. Myself I am Shruti, working as an assistant professor in the Department of Pharmaceutical Analysis and Chemistry at Sri Sharmuga College of Pharmacy. So in this video, I am going to discuss about anti-hyperlipidemic agents. So before learning this drug, it is important to understand the lipoproteins and hyperlipidemia because these forms the basis for drug therapy. So next we move on to this first slide. So in this slide, an introduction about the hyperlipidemia. So what is meant by hyperlipidemia? So it is a condition in which there are high levels of fatty particles. So fatty particle which act as in lipids, it is deposited into the blood. So the elevated plasma levels of lipid are deposited in the form of lipoproteins. So example is lipids like cholesterol and triglycerides. So these are the form of lipids present in the blood, which is deposited in the blood. So these lipids can deposit in the blood vessels walls and restrict the blood flow. So this creates a risk of heart attack and stroke. So these are the introduction about hyperlipidemia. So next, what are all the causes involved in hyperlipidemias? So first one is diet and hereditary factors, and second one is hypothyroidism, and next one is nephrotic syndrome, and third one is anorexia nervosa, and next one is symptoms lupus erythematosus. So next one is obesity, alcohol consumption, and smoking causes the hyperlipidemia, and diabetes, pregnancy, and obstructive liver disease, and acute hepatitis. So these are all the causes for hyperlipidemia. So next, what are all the symptoms involved in hyperlipidemia? Involves it loses the stools, depression, stomach distension, poor appetite, weight gain, and heart pain. So these are all the symptoms for causing hyperlipidemia. So next we move on to this next slide. So anti-hyperlipidemia. So the clinically important lipoproteins are HDL, LDL, and VLDL. So HDL is refers to the high density lipoprotein, and LDL refers to low density lipoprotein, and VLDL refers to very low density lipoprotein. So anti-hyperlipidemic drugs are used to reduce the deposited level of cholesterol and other lipoprotein from the blood plasma. So the clinically important lipoprotein includes low density lipoprotein, very low density lipoprotein, high density lipoprotein, and chylomicrons. So each of this lipoprotein plays an important role in lipid transport and cardiovascular health. So first, let us start with low density lipoproteins or LDL. So it is mainly responsible for transporting cholesterol from liver to the peripheral tissues. So when cells receive more cholesterol than required, the excess cholesterol remains in the blood. The excess cholesterol can penetrate into the arterial valves and leading to the atherosclerotic plaque formation. So therefore, the elevated low density lipoprotein level increases the risk of heart disease. So that's why LDL, which is called as low density lipoprotein, is commonly referred as bad cholesterol. So next we move on to this next type, which is called as very low density lipoprotein, so VLDL. So it is primarily act as a carrier of triglycerides from the liver to the peripheral tissues. So unlike low density lipoprotein, very low density lipoprotein is not directly measured in the blood. It is usually estimated by dividing the triglycerides by the value of 5. For example, a triglyceride level of 150 mg per deciliter corresponds to a very low density lipoprotein level of approximately 30 milligram per deciliter. So now let us look into the high density lipoproteins or HDL. So high density lipoprotein, it mainly removes the cholesterol from the peripheral tissues and it transports it back to the liver. This process is known as reverse cholesterol transport. In the liver, the cholesterol is metabolized and excreted through the bile. A high density lipoprotein level that reduces the risk of atherosclerosis. So because it is act as a protective role, and a high density lipoprotein is also known as the good cholesterol. In hyperlipidemia management, increasing high density lipoprotein and decreasing low density lipoprotein is highly desirable. So next, move on to the chylomicrons. So chylomicrons are large triglyceride rich lipoproteins, so which is formed in the intestinal cells after dietary fat intake. So after dietary fat intake, they transport dietary triglycerides, cholesterol, and fatty acids to the peripheral tissues. Structurally, chylomicrons contain a central core rich in triglycerides along with cholesterol, esters, and phospholipids. So hyperlipidemia is diagnosed by using a lipoprotein profiler, so which is a laboratory test used to measure the lipid levels. This profile provides an information on total cholesterol, low density lipid cholesterol, high density lipid cholesterol, and triglyceride levels. So these are all the parameters which helps in assessing cardiovascular risk and guide for the selection of antihyperlipidemic drugs. So next we move on to this next slide. So classification of antihyperlipidemic drugs. So it has been classified into 7 types. So first type is HMG CoA inhibitors. Example for HMG CoA inhibitors are lovastatin and atorvastatin. So second type is fibrates. So example for fibrates is cloffibrate and fenofibrate. And third one is bile acid sequestrant. So example for bile acid sequestrant is cholestyramine and clopistol. So fourth one is low density lipoprotein oxidation inhibitor. So example for this one is probucol. And next type is pyridine derivatives. So example for pyridine derivative is nicotinamide and nicotinic acid. So next type is cholesterol absorption inhibitor. So example for cholesterol absorption inhibitor include ezetimibe. So and last one is miscellaneous. So example for miscellaneous is beta sitosterol and dextrothyroxine. So these are all the classification involved in the anti-hyperlipidemic drugs. Now let us discuss about lovastatin. So it mainly belongs to the class of drugs known as HMG CoA reductase inhibitors. It is commonly called as statins. So structurally, lovastatin is a lactone prodrug. In the body, it is converted into the active hydroxy acid form, which inhibits the enzyme HMG CoA reductase. So this enzyme is the rate limiting step for cholesterol biosynthesis. By inhibiting this enzyme, lovastatin reduces the cholesterol synthesis in the liver, leading to decrease in the low density lipoprotein cholesterol level and a moderate increase in the high density lipoprotein cholesterol. So therefore, lovastatin is mainly used in the treatment of hyperlipidemia and for the prevention of cardiovascular disease. So now let us discuss about the cloffibrate. So cloffibrate is mainly belongs to the class of drugs is known as fibrates. So fibrates it mainly act as reducing low density lipoproteins or VLDL and triglyceride levels in the blood. So it works by activating the PPAR alpha receptor, which leads to increased oxidation of fatty acids and enhanced clearance of triglyceride-rich lipoproteins. As a result, there is a significant reduction in very low density lipoprotein levels and a moderate increase in the high density lipoprotein cholesterol. So therefore, cholesterol is used in the treatment of hyperlipidemia, especially conditions associated with the elevated triglycerides. So next drug is cholestyramine. So it mainly belongs to the class of drugs known as bile acid sequestrant. So it is a non-absorbable anion exchange resin that act as within the gastrointestinal tract. So it works by binding bile acids in the intestine and prevent their reabsorption. As a result, the bile acids are excreted in the fecus. To replace the loss of bile acids, the liver converts more cholesterol into the bile acids. So this leads to the reduction in plasma low density lipoprotein cholesterol levels. Therefore, cholestyramine is mainly used in the treatment of type 2A hyperlipoproteinemia, where low density lipoprotein cholesterol is elevated. So next drug is clostipol. So it belongs to the class of drugs known as bile acid sequestrants. So it is also a non-absorbable basic anion exchange resin that act locally in mainly in GIT. So it works by binding the bile acids to the intestine and preventing their reabsorption. So this increases the excretion of bile acids in the fecus. To compensate for the loss of bile acids, the liver converts more cholesterol into the bile acids. As a result, there is a reduction in plasma cholesterol levels and particularly in low density lipoprotein cholesterol. So therefore, clopistol is used to treat the type 2 hyperlipoproteinemia, especially in conditions associated with the LDL levels. Now let us understand the mechanism of action of anti-hyperlipidemic agents. First, for lovastatin, it mainly regulates the cholesterol synthesis in the liver by inhibiting the enzyme of HMG-CoA reductase. So this enzyme catalyzes the conversion of HMG-CoA to the mevalonate, which is a rate limiting step in the cholesterol synthesis. By inhibiting the microsomal enzyme, lovastatin reduces the endogenous cholesterol production in the liver, leading to decrease in low density lipoprotein cholesterol level in the blood. So next one is cholestyramine and clostipol. So these are the drugs which reduce the reabsorption of bile acids from the intestine by binding to them. As a result, the bile acids are excreted in the fecus. To replace the loss of bile acids, the liver increases the conversion of cholesterol into the bile acids. Thus, increased the catabolism of cholesterol leads to reduction in the plasma cholesterol levels, especially low density lipoprotein cholesterol. So thus, both mechanisms ultimately helps in lowering the cholesterol levels, but they act through the different pathways. Fibrate inhibits the triglyceride synthesis, which reduces the very low density lipoprotein released into the circulation. So this drug increases the lipoprotein lipase activity, which catabolizes the chylomicrons and very low density lipoprotein. Thank you so much for watching this video on anti-hyperlipidemic agents. Thank you.